Here is how to use your Diamond with an MDI canister. Remove the mouthpiece caps from both the MDI and the Diamond. Look inside both ends of the Diamond for any objects that don't belong there and check for damage. Insert the MDI mouthpiece firmly into the flexible adapter at the end of the Diamond. Hold your Diamond and MDI together and shake well according to your MDI instructions. Place the mouthpiece of the Diamond in your mouth and close your lips firmly to form a tight seal. Exhale to get ready for taking a full deep breath. Then spray 1 puff of medicine into the Diamond and begin to inhale slowly, taking a full deep breath. Diamond's high-flow warning signal will alert you if you are breathing in too fast. If you hear the signal, continue to inhale, but try to inhale more slowly with a full deep breath to allow the medicine particles to get deep into your lungs. Hold your breath for up to 8 seconds if you can, and then breathe out slowly. If your doctor has instructed you to take more than 1 puff of medication, repeat this procedure. If you take several MDI medications, you can use your Diamond with most of them. Your healthcare professional will tell you which medication to take first. Remove the MDI from the Diamond and replace the mouthpiece caps on both the MDI and Diamond before you put them away. Remember that after taking certain medicines, like inhaled corticosteroids, you need to rinse out your mouth thoroughly without swallowing the water. Follow the directions on the MDI for instructions specific to your inhaler. If you have any questions, be sure to ask your healthcare professional.